So what I want to do now is I want to take some time going over the metabolic tests that we use to evaluate your child with autism. First of all, we're going to run sensitivity testing, and this is extremely, extremely important. We need to determine if your child has a sensitivity to gluten, which is wheat, rye, oats, a sensitivity to milk, eggs, yeast, and soy. If your child has a sensitivity or an allergy, it's an IgG allergy to any of these foods, it can be promoting your child's autism because it promotes inflammation in your child's brain and body. Some of the common symptoms that you'll see with these IgG allergies are frequent indigestion, your child feeling bloated after eating. You may notice he or her have loose bowel movements, constipation. You may find that they get mouth ulcers or sores. Okay? They may even vomit often. The only way to find out if your child is truly suffering from any of these IgG allergies is to run the test. Okay? We also run complete blood panels. By using specific blood tests such as a thyroid panel, a complete metabolic panel, a lipid panel, and a CBC with differential, we're able to assess your child's thyroid gland, the adrenal glands, the liver, the kidneys, his or her red and white blood cells, and also their gut function. These are very important things to be tested. All of these tests can be affected with chronic health conditions like autism. By addressing any of these problems with your child's thyroid or adrenal glands or blood chemistry or gut function, we're able to help them heal faster. The complete metabolic panel also allows us to check your child's blood glucose levels, since glucose and oxygen are needed by the brain to function properly. That's very important. We also run what's called an adrenal stress index. Okay, you can test the adrenal glands with this test. This is a salivary test, which is much like DNA testing. You see, the adrenal glands sit right above the kidneys, and they're your stress organs, meaning that they react to stress. So if your child's body has been or is currently under stress, and I can guarantee you it is, this test must be ran. If your child is suffering from insomnia, difficulty sleeping, you gotta check this because this is looking at their cortisol levels. We also run the immune panels, which are extremely important. You see, many ADHD patients or I should say most ADHD patients that I've treated suffer from an underlying autoimmune condition. So these are very important. There are two parts to the immune system. You have your Th1 and your Th2 side. Your interleukin-2 and TNF-alpha are your Th1 cells. Th1 cells are your T cells. They're the army that attacks and cleans up afterwards. These include your helper T cells, your suppressor T cells, your natural killer cells, and your macrophages. Your interleukin-4 and your interleukin-10 are what we call the Th2 system. Your Th2 are your B cells. Your B cells make the antibodies. They're the post-it notes that tell the T cells what needs to be destroyed. If you have a high B cell count, you're Th2 dominant. So to properly evaluate your child's immune system, we run a T and B lymphocyte panel and a natural killer cell panel. We check your child's interleukin-2, TNF-alpha, interleukin-4, and interleukin-10 levels. We want to determine if they have an active antigen pattern or an immune dysregulation problem. Active antigens are parasites, bacteria, viruses, molds, foods, chemicals, and heavy metals that the body is actively trying to get out. The best indicator for an active antigen as the cause of your child's abnormal immune system function is what's called the helper-suppressor ratio on the T and B cell panel. This is also called the CD4-CD8 ratio. You see, the closer to 2.5 the ratio is, the more likely it is that you're dealing with an active antigen in your system. If the ratio falls below 1.2, then your child's most likely dealing with an immune dysregulation problem. We also run what's called intestinal permeability testing. This test is used to determine if your child suffers from what's called leaky gut syndrome. Leaky gut syndrome is a condition where the walls of the intestines have been damaged and become inflamed. This is caused by antibiotic use, toxins, poor diet, parasites, and infections. It leads to increased permeability of your gut wall to toxins, to microbes, to undigested foods, and many other molecules that shouldn't be getting through. Once these substances leak through the gut wall, they can affect the body directly, or they can cause an immune response which promotes inflammation in your child's brain and body. This is not good. How do I successfully address your child's positive metabolic findings? Well, I use specific nutritional protocols and lifestyle changes based on the results of your child's lab work. I also use a product called glutathione, which is a very powerful antioxidant. After addressing the metabolic factors, we need to use specific neurologic treatments to rehabilitate the decreased side of brain function. Some of the brain-based therapies we use include oxygen therapy. We use cerebellum rehabilitation, where we may have your child stand on the left leg and catch a ball. This stimulates that right brain. We may use vestibular stimulation, which involves spinning and head positions to stimulate various inner ear canals on the left side, and then that crosses over and signals the right side of the brain. We use hemistim visual stimulation programs, eye lights, to drive brain function. We use auditory low-frequency stimulation, which will drive that right side. Olfactory stimulation, smell. Okay, we may use unpleasant smells on the right side to initiate the right-sided withdrawal response. Okay, we use gross motor exercises, meaning we use postural muscle exercises. We may have your child perform cross-crawl exercises, neck raises, chest raises, balancing exercises to stimulate proper brain function. We also use an amazing therapy that's been well researched to help these kids, the interactive metronome. You can count on the office sessions being 2 to 3 times per week for 90 days, and each session will be about 35 to 40 minutes. You're also going to be having to do treatment at home. Parents, you have to be willing to work with your children at home and to enforce my protocol if you're going to see results. You have to be willing to crawl through glass to get your kid better. Okay? My program is very successful because of the screening process that I use in my clinic. I really only accept children that I truly believe that I can help. What I do is if I assess your child and I feel that he or she is not a good candidate for my care, I'm going to refer them to the appropriate specialist that I feel can best manage your child's condition. The good news is your child's brain function can be improved. Now again, the most important thing to understand about my program is that it is specific to rebalancing brain function. It's the combination of the metabolic and neurologic treatments that make my program successful and also what make it unique. Now in closing, I want to ask you to consider these 4 following factors regarding your child's health and well-being. I want you to picture yourself congratulating your son or daughter on a straight A report card, okay? Finally, a report card that you can brag about. It's getting tougher and tougher for kids to even get into a good college these days, and grades are more important than ever. I also understand it's hard work to compete in the business world, to have time for your family, your spouse, and then still have time to deal with helping rehabilitate your son or your daughter. I know I'm a parent of 2 girls and I love them more than anything. But what I want to say is with that said, it's so important that you take the time to do whatever it takes to give your kids the best quality of life possible. We all know that better grades lead to college scholarships, right? And I want you to imagine the joy that your child could feel receiving a scholarship, as well as the light and load that would be put on your pocketbook, right? And finally, if you really care and love your child, which I'm sure and know that you do, remember, you will have to crawl through glass to help them have the best quality of life that they can have. I did not say my program is easy. There's no easy fix for this, but I can assure you that the sacrifice is worth it. Now in closing, I would like to ask you that you please share this information with your family members, friends that you know may have kids that are suffering from the same conditions. As we mentioned earlier, there are millions of kids struggling with these same problems, and this information is not getting to them. I know that if you have taken the time to watch this video, that someone you care deeply about is being held back by autism. So please make sure to call my office at 763-398-7770 to get your child scheduled for a consultation with myself. We'll take the time, review your child's case history in detail, and discover if your child qualifies for my program. I'm looking for parents that are warriors, parents that are willing to crawl through glass and do whatever it takes to get their child better. Thank you so much for your time. Please call my office now, set up a time to get your children in, and let's get started getting them better. Thank you so much.